Hello everyone, I am Dr. Vikas Singhal, Senior Consultant Department of GI Bariatric Surgery at Medanta Gurugram, and I'd like to discuss about some details of bariatric surgery today. So bariatric surgery is a wide term that includes a lot of commonly done GI surgeries. These are surgeries that are done for obesity and metabolic problems. Several surgeries, but the most commonly done ones are the sleeve gastrectomy, the Roux-en-Y gastric bypass, and the mini gastric bypass. So these three form the almost 90% of the commonly done bariatric surgeries worldwide for obesity and metabolic disorders. So bariatric surgery works in several ways. पहले ये सोचा जाता था कि confusion था कि हम surgery के time पे कोई fat remove करते हैं, but it is very important to understand that this is not a cosmetic procedure where some body fat is removed like liposuction at the time of surgery. This is a surgery where we change the calorie intake and the calorie metabolism. So the calorie consumption goes down after the surgeries. जो calorie हम लेते हैं, consume करते हैं, वो portion size, क्योंकि या तो हम stomach का size छोटा कर देते हैं या हम intestine का काफ़ी portion bypass कर देते हैं. So either sleeve gastrectomy or gastric bypass. So surgery works both by reducing the portion size, the calories that you're consuming, and you start burning more calories. Your metabolism improves, so you start burning more calories. The third thing that happens is there are a lot of hormonal changes, that the sugar control becomes much better. Body's insulin starts working much better. So we find that the day after surgery, the diabetes in 70-80% patients can actually get completely resolved. Bariatric surgery works very effectively for treating diabetes. The hormonal changes happen immediately after the surgery. As soon as the patient starts taking diet, the body's insulin starts working much better. Especially with gastric bypass, we find that patient may be on high doses of insulin, but the day after surgery we are able to either completely stop all medicines for diabetes, or we are able to switch them to tablets, the oral medicines. And the main way this works is by the hormonal changes, by reducing the insulin resistance. So the insulin becomes much more effective because of the metabolic changes that happen with the surgery. So yes, the great part of bariatric surgery, which is why it is also known as metabolic surgery, is that almost 70-80% patients who undergo the surgery can be completely cured of diabetes. If patients are short-term diabetes, which means not more than 5 years, if they're not, they're reasonably controlled, not very high HbA1c, then they have almost 90% chance of getting cured from diabetes. So we are able to completely stop all their medicines for diabetes immediately after the surgery. If somebody who's been diabetic for 10-12 years, very high doses of insulin, not well controlled, they may not get cured, but even then their control will become much better. So we are able to cut down the insulin, their sugars are much better controlled. Generally for diabetic patients, we recommend either the mini gastric bypass or the laparoscopic Roux-en-Y gastric bypass surgery. Although the sleeve gastrectomy surgery is also very effective for diabetes, but in the long term it is shown that for poorly controlled diabetics, high HbA1c, gastric bypass surgery tends to work better in the long term, particularly for diabetes control. Yes, it's a good problem that if somebody has a loose skin, that means they have lost a lot of weight. So I would say, I always tell the patients who worry about loose skin that it's a good problem. That means that you have lost a lot of weight. For the most part, if you're exercising, if you're following the right diet, taking vitamins, you generally don't have it as a problem. But the worst case scenario, let's say in about 5% patients, is that who are very obese, they lose 50-60 kg weight. The loose skin may feel problematic, in which case we consult our plastic surgeons to tighten up or remove the loose skin, which is called an abdominoplasty, or depending on where the loose skin is. So those are some procedures that can be considered in about 5% or so patients. So yes, I would say it is pretty much permanent. Bariatric surgery has been shown to be the single most effective long-term method of sustained weight loss. About 20% patients can regain some of the weight they lose, but more than 80% patients, even 15-year studies are there now, it is shown that they have maintained most of the weight loss. And the key to that is, following a healthy lifestyle, following a good high protein diet, following the diet, if doing at least half an hour to 40 minutes of exercise, trying to do it every day. So that is the key to your success after bariatric surgery. So supplements are recommended because we are bypassing a good portion of the intestine, which is how the surgery works. But because we are doing that bypass, we also need to take some supplements in the diet, particularly in vegetarian diets. The patients need a bit of protein supplementation. Otherwise, most patients need multivitamin and vitamin D, vitamin D, B complex, sometimes also iron supplementation. So yes, it is very important because you've had so much benefits from surgery, but you also need to be under monitoring so that you don't have any problems from the surgery. With careful taking of supplements, your regular follow-ups, most problems are completely avoidable. The after effects of gastric bypass surgery are generally good, generally pleasant. I would hope that most patients are exercising, they're able to feel much more active, follow a good diet. So it generally should be mostly the after effects would be good. But yes, you should stay under follow-up of your doctor 3 monthly, make sure you don't have any nutritional deficiencies. And then once things are stable, then at least once a year follow-up in the long term should be done. Bariatric surgery in nowadays is very safe. It is very standardized. It is one of the safest GI surgeries that we do. The complication rates are typically less than 1%, as in bleeding or leak, infection, but they're very rare. The most important thing is to be under monitoring and be follow up with your doctor from time to time, as most complications are avoidable.